think it's important to draw a distinction between how the virus itself may affect men and women differently and how our global response to the virus may affect men and women differently. So the virus itself may have some different biological effects on men and women. For example, we know that based on some of the early data that we have from countries that provide sex disaggregated data, that there is a higher rate of mortality from this virus amongst men. And so there might be some biological reasons for that, but it may also be due to other gendered related phenomenon that explains those differences. For example, it may be that smoking or occupational risk might be explaining some of those differences that explain the differences between men and women. And so it's important to draw a distinction between those things. What is clear is the way in which we're responding to this outbreak is likely to have very different gendered effects. So many examples of this. So for example, we know that in previous outbreaks, a lot of sexual and reproductive health services have been deemed quote unquote non-essential in the context of outbreaks. And that can have pretty significant consequences on men and women. We know that the global response to the outbreak is also likely to have gendered effects. For example, the vast majority of healthcare workers around the world are women. And so they are going to be at an increased risk of occupational related exposure because of their gendered related occupations. It's also clear that some of the policies that we're putting into place are likely to affect men and women very differently. School closures, which is one of the most popular policies that countries around the world have implemented, is likely to have different effects in terms of the time that's required to make up for the time that children are out of the home on women who provide the vast majority of care. And then finally, I think it's really an important piece. Many countries are implementing quote unquote lockdown or quarantine, sort of forcing people to stay at home. And we know that when people live in homes that are not safe, there is an increase in intimate partner violence. And we have seen already spikes in terms of reports of these types of events happening in all countries around the world. And so we know that and women tend to be disproportionately affected by this. So it's very clear that there will be these gendered differences in our response to the outbreak.